Across the causeway, Malaysia reported a record daily high of 17,405 COVID-19 cases today. Its death toll is also soaring with 207 fatalities on each of the past 2 days. And this has led to Malaysia's undertakers working around the clock. The Straits Times' Malaysia Bureau speaks to one of them.
Their white personal protective equipment suits contrast the night sky and their grim task in the cemetery. These undertakers in Malaysia are working overtime, burying the dead.
Paling ramai jenazah yang kita uruskan campurlah jenazah kematian biasa dengan juga jenazah kematian COVID. Sudah 20 jenazah satu hari, siang dan malam. Jadi kerja penggali kubur bertambah dan jenazah pun bertambah.
Despite being in lockdown, the number of COVID-19 deaths in Malaysia has dramatically increased. In just 1 month, from April to May, it shot up more than 5.5 times to just under 1,300 deaths. The state of Selangor is the hardest hit in the country. To cope, the government will add 2 new cremation ovens. And as if a death of a loved one isn't hard enough, family members can only attend the funerals of a COVID-19 patient from afar.
Emosi apabila kita kehilangan orang yang kita sayang, jadi tak dapat nak dekat, tak dapat nak menguruskan secara normal, jadi memang mengganggu emosi waris-waris yang terbabit.
On July 26th and 27th, Malaysia saw its highest death rate yet, with 207 dead on each of the 2 days. Even as the country ramps up its vaccination drive. 40% of its adult population has received at least 1 dose of the COVID-19 vaccine. It now has one of the region's fastest vaccination rates. But sadly, for these overworked undertakers, it could not have come fast enough.
You can watch the full clip on the Straits Times' YouTube channel. Now for a closer look, Malaysia correspondent Hazlin Hassan joins me now from Kuala Lumpur. Welcome to the show, Hazlin. We've just glimpsed the workload of Malaysia's undertakers. What other challenges are they facing, Hazlin, and are there plans to help this group of frontliners?
Well, Hariranto, like most frontliners, they're sometimes having to wear PPE for hours at a time, and this can be very hot in our weather and very draining, but this is something that is unavoidable to prevent the risk of being infected with coronavirus. Some undertakers are also still waiting for their vaccinations, especially those outside Kuala Lumpur and Selangor, where the vaccination rate is a little bit slower. But the vaccination rate is now being ramped up, so hopefully they will get there soon. With the death rate still rising, and it is expected to rise even further over the next 3 to 6 months, with the Health Director General saying that the number of daily infections may even reach 24,000 in September, there are delays right now in transferring the bodies to the cemetery from hospitals and morgues, and crematoriums are fully booked every day, and casket businesses are saying that they are facing a shortage of coffins. So in Selangor, the state government is now adding 2 more crematoriums to cope with demand to prevent bodies from piling up at hospitals. And in Kuala Lumpur, the government has opened a one-stop mortuary to deal with this as well.
Hazlin, let's talk about the situation in Malaysia. Now, Prime Minister Muhyiddin Yassin has insisted that the state of emergency will not be extended past August 1st. With that date looming and given Malaysia's high case numbers, like you mentioned, what is the government's stance at the moment?
Well, Hariranto, it is now quite clear that with the withdrawal of the ordinances, which the government had argued was crucial for fighting COVID-19, the emergency wasn't actually necessary in handling the pandemic. So the government is now focusing on the National Recovery Plan and vaccinations. They aim to vaccinate the entire adult population by October, as it is looking more towards exiting the current lockdown rather than intensifying it. So it seems we have withdrawn all the emergency ordinances that were seen as crucial when cases were much lower, but they are apparently not so crucial now when daily cases and deaths are much higher than before.